Hey YouTube, welcome back to my channel, and if you're new here, welcome. My name is Melissa and my channel is all about psychiatric drug withdrawal, reactions, and recovery. I went through my own very long and very painful journey through first antidepressant withdrawal and then a subsequent reinstatement, which included more SSRIs, antipsychotics, benzodiazepines, anticonvulsants, and beta blockers. I had a series of adverse reactions. I developed a movement disorder, akathisia. I had really extreme mental symptoms, and if you're interested in learning about my whole journey in more detail, I have made a video about that on this channel. I've also made a video about my detailed reinstatement story. You can find that on my channel as well. And I also am now doing coaching. If you're interested in chatting with someone who's been through it, I offer a free 15-minute consultation or a 30-minute call or a 60-minute call, and I offer these at lower rates than other places online. I've also put together 4-session packages for those who might want to meet a little more regularly, and I've put those at a further discounted rate. I will put the link to my online booking calendar in the description box of this video. I will also include a link to my website. You can learn more about my story and read my bio in there, and you can book sessions through that as well. So onto the video. It is about neurological symptoms. So I've done a couple videos on extreme mental symptoms, the ones that I experienced. I've also done videos about physical symptoms, but I wanted to make a separate video about neurological symptoms because I think that a lot of the symptoms overlap, and it's sometimes hard to decipher what belongs under what category, and I don't think it's super important, but a lot of people experience distressing nerve symptoms. I guess I should just call them nerve symptoms because and I hear about this all the time, and I experienced a lot of them as well. And so I wanted to cover sort of what they look like, how people describe them, and because people will say, is this normal? Is this normal? And I want to talk about, like I said, my own symptoms as well as those that I hear about from clients regularly. So first of all, nerve symptoms are extremely common. I think it doesn't matter which psychiatric drug you took, although I do tend to see more severe ones with benzos, but this is not, a one size fits all. This is not straight across the board. It's just a generalization. It can happen when you switch updose, taper, come off any of the psychiatric drugs. So don't get stuck on, well, I didn't take this drug, but I'm experiencing this. It doesn't really matter because overall these drugs cause neurological dysfunction. That's why there's the whole bind out now, which is benzodiazepine induced neurological dysfunction, I believe is what it stands for. So that's sort of the overarching theme here, is neurological dysfunction and dysregulation from these drugs. And so here are some of the things that I've experienced, and there's quite a few of them. And keep in mind, so I took SSRIs for 7 years and did not experience these particular neurological symptoms. Even though I tapered in only 4 weeks, I actually only developed these once I did the reinstatement and tried the different drugs, and specifically benzodiazepines, which I took for 3 months. And then I tried to do a daily micro taper. I got down to 60% of my dose. I was very paradoxical to it. I had extremely bad, uncontrollable movements. And so I was pulled off the rest of the drug in the hospital, and then I was put in the psych ward and blah, blah, blah. Again, you can see my whole story in other videos on this channel, but these are what I experienced from coming off all of the drugs, which I've now been free of since February 21st, 2021. So it's been almost 3 years. I can't wait to make my 3-year video. I feel like the 3-year mark is really pivotal for people. 2-year and 3-year, there's a range, but for some reason, 3 years stands out in my mind as significant. So neurological symptoms. So I have experienced what I describe as nerve shocking. It could be called electricity, vibrations, but it feels like a pulsing. I don't know if it's timed to my heartbeat. I can't really tell, but it's like this. And keep in mind, again, I don't experience very many symptoms at all anymore, except if I'm in a setback, which nowadays is pretty much only due to excessive stress, or if I end up taking a medication, which I avoid as if at all possible. I only take medication now in extreme circumstances. I'm not talking about psychiatric drugs. You couldn't pay me $1 million to take another one of those again. I'm talking like antibiotics and steroids and things that can set off these symptoms once you've already had them started from psych drugs. So I have been feeling really well for quite some time now. I do have some lingering tinnitus from when I got COVID in November, which I've talked about in other videos. It started when I was reinstating, when I took Prozac actually, and was much, much, much better. And then it got worse again when I got COVID. And again, some of these symptoms I will reemerge if I'm in a setback, but they're much less severe than they used to be. And I live my life completely normally now. And it's only if I take a drug or have excessive stress where things will blip for a little bit and then go away. It's nothing that like crashes me into an intense wave anymore. It just doesn't happen. I consider myself 90% recovered. So it was like a nerve shocking. I often would feel it in my torso, in where I feel like my vagus nerve is located. Sometimes it would be in my stomach. It would be vibrations was one of them, inner vibrations. So that can be throughout my whole body, inner vibrations. And then there was this shocking feeling where it felt like it was sort of perpetuating or pulsating out of my spine, and it would go down into my butt, my legs, my arms. It was like this electrical shooting feeling, and it was really, really uncomfortable. And oftentimes these symptoms would come together, like if I was in a wave, or at the beginning they were pretty much all the time, but then once things broke up into windows and waves for me, were my like wave symptoms. So inner vibrations, a lot of like electrical pulsating shocking, I describe it as. So I had that, burning. A lot of people, especially with benzo use, experience burning. Some people talk about it like skin burning. Mine felt like not like skin burning when you have a rash or a sunburn, but just below the surface burning. Some people describe it as like bone burning or deep burning or acid blood burning. It's just this overarching burning. I had it in my body and I also had it in my head. So I've heard this with multiple people. Sometimes some people have burning mouth or burning tongue. It can really pretty much happen anywhere in the body, just this burning sensation, like things are just on fire. And yeah, so that's another nerve symptom that people experience and that I experienced a lot of. Everything just felt too hot. I've had pins and needles sensation all over my body, which felt like, like a pin pricking or just like a stinging almost. I would feel it in different parts of my body, tingling. So sometimes this was more of like a static bubbling feeling. I'd feel it in my head. I'd feel it mostly in my head, that sensation, but people can experience it anywhere in their body. So yeah, the burning, the shocking, the electricity, the vibrations. I also had sensations of like bugs crawling. So this is like formication. I've heard this from clients as well. It can be anywhere on the body. It can be on the scalp, head, face. I also would get this feeling like I described it sometimes as like hot oil dripping on my face, or like spiders dancing around, although it felt hot, like a hot dancing movement on my face. This often was accompanied by pain. So sometimes I would think I had a toothache or I had a sinus infection, but I think it was just because I would often get these checked out. I went to the dentist several different times with this pain in my face and they never could find anything. And so I was like, well, it's got to just be neurological dysfunction or nerve symptoms from these goddamn drugs. So I'd feel a lot of pain in my face, and that was oftentimes with the sensation of either like pricking or tingling or this hot oil dripping feeling or spiders dancing feeling or tingling. I mean, it would change all the time. But a lot of the times the symptoms would come together, the pain, the burning, and then these nerve feelings. So those are quite common ones, and they're all quite distressing. Deep burning pain, buzzing. Some people talk about it like a buzzing sensation. I'm just trying to think of other ways that sometimes a thrashing, so it'll feel almost like there's like movement going on, or a churning. I would feel that in my stomach. I'd feel this like churning sensation, like something was twisting and turning. It was really uncomfortable. And when I had the movements, A lot of times it would stem from my stomach, so my body would be kind of crunching in half at the stomach. I had it in my arms, I had it in my legs, and again, I would often experience at the same time this. I would describe it sometimes to my mom like I feel like I'm going to have a seizure. I could just feel this electrical activity. Brain zaps really common, so I only had those coming off SSRIs, and for me they only happened for about a month. And that was more like it was like a zapping that almost felt like my head was doing this. It would happen quite often, but yeah, but it went away like I said after about a month. So those types of nerve sensations, I'm trying to think if there's anything else that people experience. You can feel like a wetness. Some people will describe like a wet or full feeling in their ears, burning tongue, which I already mentioned, pain pretty much anywhere in the body. People experience pain, neuropathy type sensations, numbness. That's another one where people will be numb in different parts of their face, or it can be in their feet, or it can be in their hands. Anywhere in the body, there's small fiber neuropathies, peripheral neuropathies, all these neuropathies that come along with these stupid drugs. I had this horrible pain in my first withdrawal in my left foot, and I freaked out for a long time because I thought, oh no, I'm developing neuropathy from my long-standing diabetes. But it didn't really follow the typical pattern, where people will feel numbness or pain or tingling sensations at the tips of their toes, and then it kind of moves back further into the foot and then up the leg. Mine was always on the bottom of my foot, and it was just this intense gnawing pain. Sometimes it was sharp or shooting or stabbing. So I would wrap my foot in an ice pack, like one of those ones that had a stretchy band around it and would Velcro. So I'd strap that to my foot with a sock on at night just so I could sleep, because at that point I wasn't hypersensitive to medications like I am now. That only happened after I reinstated and took benzos. But I would take like Tylenol or just sort of over-the-counter pain relievers, and it wouldn't really help. I did take gabapentin for a while, and all that really did was make me feel high. It didn't really take my pain away. So I just started using ice. And sometimes I would feel it in my right foot as well. So some nights I'd go to bed with my feet in socks with these ice packs strapped around the foot. Because once I could kind of numb it, then it would feel a little bit better and I could at least fall asleep. Another sensation that people get is itching. So sometimes it feels like a deep internal itch. Sometimes it'll feel like surface level itching. Again, it's this agitated nerve feeling, agitation. I mean, just like your nerves are dancing around or pulsing or moving and they shouldn't be, or just being hyper aware of your nerves. I mean, normally you go about your life and you're not aware of your nerves at all unless something goes wrong. You develop a neuropathy, or in this case, all of these neurological or nerve feelings. So I experienced most, if not all of those. There's maybe a couple that were not really for me, but that's what I hear most commonly. And again, like akathisia is the inner restlessness, the inner turmoil, and then all of the mental stuff. It's all related, but I just wanted to make a video about the specific sort of physical manifestations of nerve issues that I hear about and have experienced with these horrible drugs. So let me know in the comments if this has been your situation and if there's anything that you do for it. When I was earlier on in my recovery and my movements were quite bad, but they had somewhat dissipated from like the extreme acute, but I took beta blockers and that did help. I took them for about 4 months. I'm not on them anymore. I haven't been for about 33 months, I'd say. And that really did help. And so I was able to engage a little bit more in life once I was on a higher dose of a beta blocker. And so once that happened and I could go out more, I would go to the pool and I would just glide around in the water. I took a lot of showers and baths, and I found that water was soothing and calming for me. So yeah, I would go swimming and that would help. And I've had clients who have said the same thing. They experienced the burning and all of the really uncomfortable sensations, and being in the water, swimming, gliding, does help that a little bit. Nothing is a perfect fix, but it alleviates some of the symptoms some of the time. So yeah, let me know what kind of nerve symptoms you've experienced, and if there's anything that you are able to do to sort of help them, or that lessens the sensations. I know it's very uncomfortable. I don't, again, really experience these symptoms anymore unless I'm under an excessive amount of stress or I take a medication, which is very, very rare. So there is definitely hope. I tried all of the treatments, I tried all of the supplements, and it was only time and a lot of self-care that just let things settle out over the long run, including the mental stuff, which I had really bad. And again, all of the symptoms overlap, and a lot of people experience them in clusters during waves or in acute all the time. So the mental stuff, other physical stuff, headaches, migraines, all the things that come along with withdrawal, it pretty much can affect you from head to toe. And then all of these neurological symptoms. So hold on tight. Things really do get better over time, no matter what you're experiencing. I think I've made a video too about muscle issues and muscle symptoms specifically. Again, often comes along with nerve symptoms, not always, but often. But this is just about nerve symptoms specifically. So let me know if you've experienced them, how you alleviate them, if at all, and how you cope with them. And I'll see you guys in the next video. Bye.